What is undiagnosed hypertension, and what are the health risks of undiagnosed hypertension? Undiagnosed hypertension, also known as high blood pressure, refers to a condition in which a person has persistently elevated blood pressure levels, but is unaware of it because they have not been diagnosed through blood pressure measurements or medical evaluations. It is often considered a silent condition because it typically does not present noticeable symptoms, especially in its early stages. As a result, individuals with undiagnosed hypertension may go for extended periods without realizing that they have high blood pressure. The health risks associated with undiagnosed hypertension can be severe and may include cardiovascular disease. Undiagnosed hypertension is a leading risk factor for various cardiovascular diseases, such as heart disease, heart attacks, and stroke. The continuous high pressure on the walls of the arteries can lead to the development of atherosclerosis, the buildup of plaque in the arteries, which increases the risk of these conditions. Kidney damage. Persistent high blood pressure can damage the small blood vessels in the kidneys, reducing their ability to filter waste and excess fluids from the blood. Over time, this can lead to chronic kidney disease or even kidney failure. Vision problems. Hypertension can damage the blood vessels in the eyes, increasing the risk of vision problems and even blindness. Cognitive impairment. Some studies suggest a link between untreated hypertension and cognitive decline, including an increased risk of dementia and Alzheimer's disease. Aneurysms. High blood pressure can weaken the walls of blood vessels, making them more prone to developing an aneurysm, which is a potentially life-threatening bulge or rupture in a blood vessel. Peripheral artery disease, PAD, untreated hypertension can reduce blood flow to the extremities, leading to PAD, a condition characterized by narrowed arteries in the legs, increasing the risk of pain, ulcers, and even amputation in severe cases. Heart failure. Over time, the heart has to work harder to pump blood against high blood pressure. This increased workload can lead to the development of heart failure, where the heart can't pump blood effectively. Stroke. Hypertension is a major risk factor for ischemic strokes, which occur when a blood clot blocks an artery in the brain. It is also a risk factor for hemorrhagic strokes, which involve bleeding in the brain. Other health issues. High blood pressure can exacerbate other health conditions, including diabetes, sleep apnea, and metabolic syndrome. Reduced life expectancy. Individuals with undiagnosed and untreated hypertension generally have a reduced life expectancy compared to those with well-controlled blood pressure. It's important to note that early detection and management of hypertension are crucial in preventing these health complications. Regular blood pressure checks during routine healthcare visits are essential for diagnosing and managing hypertension. Lifestyle changes, medication, and medical supervision can help control blood pressure and reduce the associated health risks. If you suspect you may have high blood pressure or are at risk, it's advisable to consult a healthcare professional for evaluation and guidance. Public health burden of undiagnosed hypertension globally and in India. Undiagnosed hypertension, also known as high blood pressure, is a significant public health burden both globally and in India. To understand this burden, it's essential to explore the prevalence, consequences, and contributing factors associated with undiagnosed hypertension. Global perspective. Prevalence. Hypertension is a common medical condition globally. According to the World Health Organization, WHO, in 2019, it was estimated that about 1.13 billion people worldwide had hypertension. A substantial portion of these individuals remains undiagnosed. Consequences. Undiagnosed hypertension is dangerous because it often goes unnoticed until it leads to severe health complications. These complications can include heart disease, stroke, kidney problems, and vision impairment. It is a leading risk factor for cardiovascular diseases globally. Contributing factors. Several factors contribute to the public health burden of undiagnosed hypertension. Lack of routine health checkups. Many individuals do not regularly visit healthcare professionals for checkups, leading to undiagnosed hypertension. Limited access to healthcare. In lower-income countries, access to healthcare facilities and medical services may be limited, making it challenging for people to get their blood pressure checked. Poor awareness. Lack of awareness about hypertension and its risk factors can result in delayed diagnosis. Lifestyle factors. Unhealthy diets, sedentary lifestyles, and high salt intake contribute to the development of hypertension. Indian perspective. In India, the burden of undiagnosed hypertension is particularly pronounced due to the country's large population, diverse healthcare infrastructure, and unique socioeconomic factors. Prevalence. The prevalence of hypertension in India has been steadily increasing. A study published in The Lancet in 2019 estimated that nearly 1 in 3 adults in India had hypertension. However, a significant proportion of these individuals remained undiagnosed. Consequences. Undiagnosed hypertension in India is a major contributor to the growing burden of non-communicable diseases, NCDs. Cardiovascular diseases are the leading cause of death in the country, and hypertension plays a crucial role in this statistic. Contributing factors. The public health burden of undiagnosed hypertension in India can be attributed to several factors. Limited healthcare infrastructure. In rural areas, access to healthcare facilities can be challenging, leading to underdiagnosis. Lack of awareness. A lack of awareness about hypertension and its risk factors is prevalent in many parts of India, especially among rural populations. Lifestyle and diet. Rapid urbanization and changing lifestyles have resulted in unhealthy dietary patterns and sedentary behaviors, increasing the risk of hypertension. Addressing the burden. Efforts to reduce the public health burden of undiagnosed hypertension should focus on increasing awareness through public health campaigns, expanding access to healthcare services, particularly in rural and underserved areas, encouraging regular health checkups, especially for individuals at higher risk, promoting a healthy lifestyle, including a balanced diet, physical activity, and stress management. Undiagnosed hypertension poses a substantial public health burden both globally and in India, leading to severe health consequences and healthcare costs. Addressing this issue requires a multi-pronged approach involving healthcare systems, public awareness campaigns, and individual responsibility for maintaining a healthy lifestyle. An understanding of the public healthcare intervention to manage undiagnosed hypertension globally. Managing undiagnosed hypertension on a global scale is a significant public health challenge, but various interventions and strategies have been implemented to address this issue. These interventions aim to increase awareness, improve access to healthcare services, and promote early detection and management of hypertension. Here's an understanding of some key public health interventions to manage undiagnosed hypertension globally. Health education and awareness campaigns. Public health agencies and organizations conduct educational campaigns to raise awareness about hypertension, its risk factors, and the importance of regular blood pressure monitoring. These campaigns often use mass media, social media, community events, and healthcare providers to disseminate information. The goal is to empower individuals to take control of their health by recognizing the significance of blood pressure management. Community outreach and screening programs. Many countries organize community-based health programs to offer free or low-cost blood pressure screenings. These programs target underserved populations, including those in rural areas or with limited access to healthcare facilities. Community health workers may play a vital role in conducting screenings and providing education. Integration of blood pressure, monitoring into primary care. Encouraging routine blood pressure checks as part of primary healthcare visits is crucial. Healthcare providers are trained to measure blood pressure accurately and identify individuals with hypertension. Integrated care models also involve follow-up and management for those diagnosed with high blood pressure. Task shifting and training of non-physician healthcare workers. In regions with a shortage of healthcare professionals, non-physician healthcare workers like nurses and pharmacists may be trained to diagnose and manage hypertension. Task shifting helps reach more individuals and improve early detection. Use of mobile health, mHealth, and telemedicine. mHealth apps and telemedicine services can facilitate remote monitoring of blood pressure. These technologies enable individuals to track their blood pressure at home and share the data with healthcare providers for assessment and guidance. Policy interventions. Governments and healthcare systems may implement policies to promote blood pressure control, such as requiring blood pressure measurement in schools, workplaces, and public places like pharmacies. Patient education and self-management programs. Empowering individuals with hypertension through education on self-monitoring, medication adherence, and lifestyle modifications is vital. Self-management programs often include dietary recommendations, physical activity guidance, and stress reduction techniques. Access to affordable medications. Ensuring that medications for hypertension are affordable and accessible to all is critical. Governments and healthcare systems may negotiate lower drug prices, offer subsidies, or provide free medications to vulnerable populations. Global initiatives and partnerships. International organizations like the World Health Organization, WHO, and non-governmental organizations, NGOs, often collaborate to develop and implement strategies for hypertension control. These initiatives may focus on sharing best practices, research, and technical support. Regular monitoring and evaluation. Continuous surveillance of hypertension prevalence, diagnosis rates, and control rates is essential to assess the effectiveness of interventions. Data-driven decision-making allows for adjustments and improvements in public health strategies. Managing undiagnosed hypertension globally requires a comprehensive, multi-sectoral approach that involves governments, healthcare providers, communities, and individuals themselves. By implementing these interventions, public health efforts aim to reduce the burden of undiagnosed hypertension, prevent associated health complications, and improve overall population health. An understanding of the public healthcare intervention to manage undiagnosed hypertension in India. Managing undiagnosed hypertension in India is a critical public health challenge given the country's large and diverse population. Public health interventions to address undiagnosed hypertension in India need to consider various factors, including limited healthcare access, diverse cultural practices, and varying levels of awareness. Here's an understanding of some key public health interventions to manage undiagnosed hypertension in India. Awareness and education campaigns. Public health campaigns are conducted to raise awareness about hypertension, its risk factors, and the importance of regular blood pressure monitoring. These campaigns often use multiple communication channels, including television, radio, print media, and community outreach programs. Culturally sensitive messaging is crucial to resonate with different regions and populations within India. Community-based screening programs, mobile health clinics, and community health workers play a vital role in conducting blood pressure screenings in rural and underserved areas. These programs aim to identify individuals with undiagnosed hypertension and provide them with information about the condition and available resources. Integration of hypertension services into primary health care. Encouraging routine blood pressure checks as part of primary healthcare visits is crucial. Healthcare providers at primary health centers are trained to measure blood pressure accurately and identify individuals with hypertension. Integrated care models involve follow-up and management for those diagnosed with high blood pressure. Task shifting and capacity building. Due to the shortage of physicians in many regions, non-physician healthcare workers like nurses and pharmacists may be trained to diagnose and manage hypertension. This approach helps expand the reach of healthcare services, especially in remote areas. Telemedicine and mHealth solutions. Leveraging technology for telemedicine and mobile health apps can facilitate remote monitoring and management of blood pressure. These solutions are particularly useful in rural and remote areas where access to healthcare facilities is limited. Policy interventions. The Indian government may implement policies to promote blood pressure control, such as mandatory blood pressure checks in certain settings like schools, workplaces, and public health campaigns. Regulations may also focus on reducing salt intake in processed foods and promoting healthier dietary choices. Patient education and empowerment. Empowering individuals with hypertension through education on self-monitoring, medication adherence, and lifestyle modifications is crucial. Self-help groups and community-based programs can provide support and information to individuals with hypertension. Access to affordable medications. Ensuring that medications for hypertension are affordable and accessible to all is essential. Government initiatives may include price controls, subsidies, or free distribution of essential medications for vulnerable populations. Public-private partnerships. Collaboration between public health agencies, private healthcare providers, and non-governmental organizations can enhance the reach and effectiveness of interventions. Monitoring and evaluation. Continuous surveillance of hypertension prevalence, diagnosis rates, and control rates is essential to assess the impact of interventions and make necessary adjustments. Managing undiagnosed hypertension in India requires a tailored approach that considers the country's diverse population and healthcare landscape. By implementing these public health interventions, India aims to reduce the burden of undiagnosed hypertension, prevent related health complications, and improve the overall health and well-being of its citizens.